Okay, everybody, let's get started. Welcome everybody to the Plains to Peaks Learning Opportunity. It's January 23rd, actually, 2019. And hopefully you can all hear me okay. I am talking on my phone because I'm actually right now I'm in Alaska doing some work with Alaska Department of Health at their health summit around shared risk and protective factors. And so my internet is the connection might be a little spotty. So Allie is a co-host and she's actually going to be facilitating this meeting. So hopefully that will help in case I get kicked off and you can continue the meeting at least via the webinar. So let's start with introductions. I think because there's quite a few of us, I'll go down the list and call out your name, and then if you could introduce yourself and where you're from, and then we'll start the discussion that Allie Mackey is going to be facilitating for us around our legislative sessions and policy, since we're in a full swing in a lot of our states right now. So I'm Colleen Kapsamalis. I'm a program integration and evaluation unit manager at the Violence and Injury Prevention Mental Health Promotion branch here at the Colorado State Health Department. And then Allie, do you want to go next?
Sure. I'm Allie Mackey. I'm the Policy and Communication Unit Supervisor here at CDPHE in the Violence and Injury Prevention Mental Health Promotion branch. And so I work on monitoring legislation and supporting legislative responses for the branch. And then I also manage our retail marijuana and community.
Thanks, Allie. Jeannie, you're next on my list if you don't mind introducing yourself.
Yep, Jeannie Beets, Motor Vehicle Safety Coordinator for the Nebraska Department of Health and Human Services.
Thanks, Jeannie. Next on also I have Dana.
Hi, this is Dana Zolk. I'm the Section Director for Injury and Violence Prevention Programs in the Bureau of Health Promotion at the Kansas Department of Health and Environment. This is the position that Lori Haskett previously held.
Okay, well, welcome, Dana. I'm glad that you're able to join us.
Thank you.
Dwayne? I can't hear you, Dwayne, if you're talking.
Hey, it's Dwayne Smith, Population Health Strategist and Injury Prevention Program Manager at Children's Hospital Colorado in Aurora, Colorado.
Thanks. Next, I have Leisha Peterson.
Yeah, hi, this is Leisha Peterson. I'm with the Missouri Department of Health and Senior Services, and I am the Injury Prevention Program Manager here.
Great, thanks. Thanks, Leisha. Christine.
Hi, this is Christine DeMont with the Colorado Department of Public Health and Environment, and I'm an injury epidemiologist. Also, big focus on motor vehicle safety.
Great, thanks, Christine. Something just happened to my screen.
Same here.
For you too.
Mm-hmm. Everybody switched order.
Okay, well, we'll try and keep track. Let's see, Jenna, you're next. Jenna? Maybe she might have just logged on. Okay, we'll come back to Jenna. Celeste?
Can you hear me?
Oh, now we can, Jenna.
Yeah.
Oh, okay.
Oh, yeah, and I see that you also wrote in the chat, too.
Oh, that's Celeste. This is Jenna. Sorry, I did just log on.
This is Jenna, sorry.
What were you asking?
Jenna, go ahead.
This is Jenna Jones with the Colorado Department of Public Health Services, Motor Vehicle Safety Manager.
Okay, and then it looks like Celeste typed into the chat. She doesn't have a microphone, but she's the health surveillance specialist in the Office of Injury Surveillance in Nebraska. So thank you for joining us. Jamin?
Hi, I'm Jamin Johnson with the Wyoming Department of Health. I'm the Child Health Program Manager in the Maternal and Child Health Unit, and I also work very closely with our Injury and Violence Prevention Program.
Great, thanks, Jamin. And then, Kate Cohen?
Hi, this is Kate Cohen. I'm a community outreach specialist with the Violence and Injury Prevention Mental Health Promotion branch at the Colorado State Health Department.
Okay. And Mandy?
Hi, everybody. Mandy Sligg, North Dakota Department of Health Injury Prevention Program Director.
Thanks, Mandy. And then Sarah?
Hi, Sarah Brandspiegel here. I'm with the Colorado School of Public Health.
Thanks, Sarah. Carol?
Hi, Carol Runyon. I'm also with the Colorado School of Health, School of Public Health, but living in North Carolina, so calling in from afar.
Thanks for joining. And then it looks like we have a couple people from the CDC, so if you could introduce yourself. Sally, you're on.
Yeah, hi, this is Sally Thigpen. I'm an evaluator here at the CDC, and I work with the NPLTs and RNCOs.
Great. Thanks. And finally, Kimberly. I can't hear you, Kimberly, if you're talking.
Sorry, I did the wrong unmute button. So this is Kimberly Evans, and I'm a project officer here in Darby, and I am the Chorus Fit project officer for Utah and Ohio.
Oh, great. Thanks.
Thanks.
Kimberly, your screen says Kimberly Davis. Did you used to work with the school health programs?
I didn't.
No.
And yeah, I am newly married, so I have to figure out how to change that. Since the last time that I think I joined this call, but no, I haven't worked with any school programs.
Okay, congratulations.
Thank you.
Okay, I think that covers everybody. If I missed you, please chime in now, but I think I was keeping track, and I don't see any other new names. So with that, I'll pass the torch on to Allie. So thanks for facilitating today, Allie.
Sure. So I'm really hoping today is more about hearing from all of you of differences in your states and what's happening. Just an opportunity for us all to touch base and share resources about our current legislative agendas and how we got to this point, maybe learning some lessons from each other. More so, our experience in Colorado is going to be different than anywhere else, and there's all different legislative priorities. And so what I'd love to do is just hear from each of you. I'm going to share my screen. Share. I decided not to do videos. Can you all, is the right screen showing? Can you see my PowerPoint?
Yes.
No, it looks like it's over. There it goes. Starting. There it is.
Yes.
Perfect. All right, I have to look around my other screen here. Come on. Present. There we go. Okay, so the framework that we use a lot actually comes from the CDC, and I put the link in the chat to this full document. And the full document talks about the state health department's role in the policy process. And it is a tool for state health departments' injury and violence prevention programs developed by the CDC. And I use this quite a bit with our own internal policy trainings and our work with our local communities. I am, or was previously, one of the national trainers for the Systems Change for Health curriculum, developed out of UNC, but it follows pretty much the exact same process. So I find this to be really helpful just to talk through the work that we're doing. At the center, you can see stakeholder engagement and education and evaluation are always part of the work that we're doing, but really starting with the public will piece, the problem identification and policy analysis, what do we know works, and then the political will, the strategy and policy development, and actually getting the policy enacted. And so I was just going to use this framework for us to talk through what we've seen in our communities and our states as priorities, both from our standpoint of problem identification and looking for what works versus political will for what current agendas may include. I love this quote. In politics, nothing happens by accident. If it happens, you can bet it was planned that way. And so behind the scenes, all of us, all of our stakeholders, and all of our politicians are doing something and planning something. And so thinking through the problem identification, I'm curious, is anyone not currently in a legislative session? Does everyone have an open session right now? I'm pulling up chat just to monitor it.
Yeah, I'm trying to think back. I know last year we had done some timelines and didn't do that this year, but I can speak. I know Colorado's in a session and North Dakota. What about Nebraska or Wyoming?
Nebraska's in, yep. I know some states do occasional, they do like a budget year and then a policy year. But sounds like nobody's chiming in that you're not in a legislative session. Jamin said Wyoming is in. Okay. So leading up to your legislative, Celeste said we have a long year and a short year. This is the long year. That's good to know. More things can make it through in a long year. So thinking through leading up to your legislative session, what were the problems that were being identified and what were the solutions being proposed? And so really thinking the landscape is often some type of assessment of what does the data say our issues are? What is the perception of our issues? So for us here in Colorado, the data says suicide's an issue for white working age males, but the perception is that we have a teen issue in our state. So it's kind of the difference there between data and perception. What you know people might have political will to address. What are your values and what are your priorities? All of that kind of feeds into what becomes the priorities. So leading into your legislative sessions, what all did you see, either through data, perception, values, priorities? What did you all see popping up?
In North Dakota, this is Mandy. In North Dakota, we brought forth primary belt legislation, and we started working on like all the ins and outs, looking at the data, you know, talking about public perception. There was even a survey that was completed to the residents of North Dakota, and it showed that 62% of North Dakota residents were in favor of a primary belt law. So we had started working on that right after our last policy session ended. We're on a policy session on the odd years, and then we have a budget-only session on the even years. So that was kind of what happened in North Dakota, and currently our primary seatbelt legislation did pass in the Senate, so it's on to the House. So.
Oh, Mandy, that's awesome. Mandy, what was the stakeholder engagement like kind of on the off session in order to get to that place, and who all, sorry, I'm hitting the wrong button. What was the stakeholder engagement like, and how did you get people engaged? Were you the only sponsors of that survey? Was it a broad effort?
Well, the survey was led by the North Dakota Department of Transportation. And in January of 2018, the Department of Transportation, along with, they were the lead agency on a Vision Zero initiative. And so the Department of Health and the Highway Patrol are teamed up with them, and we rolled out this initiative. So it was all about infusing, you know, safety and getting to zero fatalities on North Dakota roads. So getting that into communities, and the DOT has a program called Vision Zero Community. So getting communities on board, and there's a list of activities that they can work towards to help their community. And, you know, a lot of them are evidence-based strategies, but some of them are not, just because they wanted engagement. So they just are encouraging people to, you know, provide any activities if they're interested in participating in being a Vision Zero community. But there are steps that they have to go through there's an application process and that kind of thing. So that was one of the activities that was completed.
That's great. Really exciting. Yeah, really expanding that engagement base across the state and getting other people invested in those initiatives. That's great. And then Dwayne wrote Children's Hospital Colorado legislative priorities for 2019, behavioral health for kids, protecting and expanding healthcare coverage and access to all kids, prohibiting e-cigarette use in public, and advancing healthy eating and active living. And I always joke, so my daughter is a Children's Hospital Colorado patient, so I always joke with Dwayne whenever he calls me that he scares me to death, that I think the hospital's calling about my kid. I 3 cheers for protecting and expanding healthcare coverage and access for all kids, because that's definitely really important. Dwayne, I'm curious, what is children's stakeholder process like? If you wouldn't mind jumping on audio and sharing just a little bit more about how Children's comes up with those priorities? Dwayne, you're not coming through if you're talking. I can hear some sound from you, Dwayne. Can you hear us? Okay, well, we will move on. Anyone else? What were kind of the prioritization processes before the session to get your issues heard?
This is Colleen. The one that comes to mind is actually, and Allie, you can probably chime in around this too, but we had an interim legislative committee looking at opioid overdose prevention policies. And so that was an interim committee in between last year's legislative session and this year. And that committee was able to prioritize bills related to that issue and move them forward to the legislative session. Interestingly, even the bills that didn't get prioritized by that committee, it sounds like they may be introduced by individual legislators or sponsored by individual legislators that were involved. And so it'll be interesting to monitor and see where that goes.
Yeah, that was a fascinating conversation. They wanted a bill on prevention, a bill on treatment, a bill on recovery, all these different things. And when they started talking about the prevention bill, they said, okay, so prevention, that's going to sit with law enforcement, right? And the whole audience just was like, no, which, you know, is not normally typical decorum in a legislative session. So it was pretty interesting engagement with the public at that point. And then I'll say, I know that we were expecting such high rates of turnover within our state legislature as well as our governor that it was really hard for people to try and work on priorities in the off session this year, not really knowing what priorities would rise to the top based on who would win various elections. And so it was kind of a weird year. That was my first governor transition, and only the second time I went through that big of a legislator transition in our state, so it was hard to guess. All right, Dwayne's going to try again to share. Hopefully his headset's working this time. Dwayne, you want to share more about children's community engagement process and priority setting? Dwayne? All right, it might not work. Anyone else have any stories to share about kind of off session working on priorities? Okay.
It looks like Celeste chimed in, Allie, on the chat.
There. Thank you. There's always a helmet bill repeal that comes up in Nebraska, so we prepare a fact sheet in advance. Has it come up yet for you, Celeste? Yes, already.
Yeah, this is Jeannie. To kind of go along with that, we've had some good momentum in traffic safety because our child passenger safety law was changed effective January 1st. We had a lot of good improvements with that. So then a lot of our stakeholders continue to work with that same senator to then introduce a primary seatbelt law and a primary texting law. And so we have some momentum. So we're hoping one of those two will continue to move forward. And like Celeste said, we do have another bill introduced to repeal our motorcycle helmet law as well. And so we're always prepared every year now. We've been doing a better job of being proactive and being prepared with our data sheets and, you know, not only saying what's going on in Nebraska, but also what the evidence-based practices are. If we're going to do this, we need to do it the right way. And so year after year, we're just really updating those policy guides and making sure the data is accurate, and then following that up with evidence-based practices and links to all those evidence-based practices, so they don't think that we're just making stuff up, which they tend to like to do. So
yeah, they do. Did you have a big turnover this year in legislators where you felt like you needed to do a lot of new education?
We did, but I think our partners through our Drive Smart Nebraska Coalition, they're there. They're on the ground. They're meeting with them. They know who's on. We have before it gets debated on the floor, we have a transportation committee that has to just even vote this stuff out of there first before it can be debated. We only have just the one. We're just a unicameral, so then if it can get out of the committee, then it can be heard by all the senators and be debated and that. So first they have to work with the group to get it out of committee, so then it can be heard by all of the senators as well. So
great. So it sounds like a lot of motor vehicle, opioid prevention. Any other kind of topics out of left field or things that people are prioritizing in your communities?
We have in North Dakota, this is Mandy, we have a bunch of medical marijuana bills. There's additions to our medical marijuana, and one of them is edibles.
Interesting.
And I'll just make this little caveat, and I think the reason that it got brought up this session was because previously it was voted on by the public, but the measure was such a mess that the legislature had to go in last session in 2017 and clean a lot of things up because there was conflicting language because the measure, how it was written, things were pulled from different states, so there was conflicting language in some parts of it, and so some of the things were taken out by the legislature, and they did a great job, I think, cleaning up the bill and you know, getting it so that it was able to be carried out by our medical marijuana division. But I think some people weren't happy with the fact that some of the things got removed. And so that's why they're coming back. I think along with the edibles one, I think there are 5 other bills relating to medical marijuana.
Very cool. Is the medical marijuana registry run by your health department?
Yeah, it is. It's its own division. So we have a medical marijuana division that regulates things.
And have they passed any per se legislation or anything related to marijuana impaired driving in your state? Sorry,
no, not to my knowledge, and you know, that's a concern for law enforcement and stuff, just because there's no good way to measure it, and so yeah. The good thing was that I think our legislators, I was just in the medical marijuana edibles hearing, and there were several questions from some of our representatives in the Human Services Committee regarding safety with children. There were several of them that were very concerned. So I thought that was really good that they, you know, are paying attention and thinking about, you know, the kids and that kind of thing, and about safety and packaging and how things would be stored. So
That's awesome. Well, Mandy, so I work a lot on our marijuana stuff, and so I won't derail the conversation too much, but I will to Dwayne's Horn over at Children's Hospital. They had staff write a health impact assessment on how to protect children from edibles. That is like 5 years old now, and we've definitely learned even more since then, but that health impact assessment essentially focusing on opaque packaging, meeting federal guidelines for child resistance through age 5, and making them resealable so that if you don't eat all of the edible, but that you can reseal it in a way that reinstates the child resistance aspects of the packaging. That health impact assessment was vital for us in some of the first bills that passed in our state, and Children's did a great job with that, I think in partnership with the school public health. And then we've definitely learned about a lot of other things since then about dosing, and but we do continue to see they're about to come out with our latest report, and you'll see poison control calls continue to rise for 0 to 8.
I would be interested in seeing that report, just because that was one of the things that in opposition to this bill, a private citizen came up and opposed the bill because he felt that the dosing was too low for the edibles. And
that is hard for medical versus recreational. We do not have good, as I'm putting that into the wrong screen for you all to see, we do not have good medical dosing. So let me, sorry, I'm just going to chat it to everyone so you can see it. Preventing unintentional ingestion of marijuana by children, health impact assessment of packaging regulations, and it was August 2013. And yes, Piper was in on it, which is Carol and Sarah, who are on the call, part of their shop too, along with Children's.
Thanks for sharing.
Yeah. So then getting to the strategy and the policy development piece, curious, actually, before we go there, I'm sorry, I forgot, Dwayne sent me a message with their engagement piece. So Children's Hospital uses their Child Health Champions Network, which is a grassroots advocacy effort with more than 8,000 members across the state and region, includes patient families whose lives and patient care experiences are heavily influenced, or do heavily influence the direction and how they better serve kids and families from the hospital. So that's a pretty broad and really engaged stakeholder network to be able to help set those priorities. So then strategy and policy development. So really thinking about the political agenda, and I think we've kind of started to venture into this, not just the public will, but the political will and what's happening. We know that events can really change attention on different issues. The data, complaints, knowing that timing is everything and we have to do our homework to know how our legislators feel. So what experiences have you all had in the political agenda that was set within your state versus what problems you were trying to address?
I feel like this would be a good time for Jenna to chime in around our primary seatbelts.
I was just going to private chat Jenna and be like, hey, tell your story.
So Jenna, if you can hear, yeah.
Yeah, I'm happy to. So I work with the Department of Public Health, but I consult with the Department of Transportation and run our occupant protection task force. And so in Colorado, almost every year a primary seatbelt bill comes up, and so we anticipated that it would come up again this year. We had a senator who had run it last year and was interested in running it again this year. And so we worked kind of in the time between sessions to do a lot of prep work because it's not typically on the highest end of the Department of Public Health's priorities, but it is for the Department of Transportation as well as for State Patrol. I think it was their #1 agenda item. And so, and Kate Cohen, feel free to chime in. We did a series of projects. We led a training this summer that was hosted by CDOT to bring together folks who are interested in policy work from all different topic areas. So we had sexual violence prevention, we had transportation, we had suicide prevention, child fatality prevention, and we kind of did some overall training on just a very basic level of how to understand the policy process, how to think through what your goals were. And we kind of had geared this up because we knew a lot of these advocates would be very interested and are interested in primary seatbelt legislation, but also how they could find the connections between folks working on other health issues. So that was really helpful, kind of got people thinking about how do you talk about the issue and how do you start to think about what does your community look like in terms of who needs to be educated about it. And then we created a fact sheet, which we do every year, and some talking points and some advocate guidelines. And we use primary seatbelt as an example. And it kind of walks people through how, what you need to think about when you're identifying kind of who are those grass tops leaders, you know, who are the key stakeholders around this issue in your community at the state and local level. You know, and being really cognizant of what folks are able to do and what they're not able to do, and kind of trying to differentiate that, because a lot of our government folks at the state and at the county level are not allowed to do the talking, but on their local coalitions or in their stakeholder groups, they might have somebody that is, because they're a business owner or a nonprofit leader or whatever that is. And so understanding where you fall in that, and then how to identify who you want to educate, and then kind of thinking through what are their values, and so how can you pitch those talking points to what they care about most. And so we made sure to find pieces that related to financial concerns, individual liberty concerns, you know, just a range of things, and then came up with some frequently asked questions. So people didn't feel like they were going in and having to come up with their own talking points, but that they could modify it based on their community, because in Colorado, as I'm sure in most states, where you live is really different values and politics and culture, and so there's not going to be one right way that fits everything. So we did a lot of this, and we had started kind of developing a network of folks who were going to do different things, and we sat down with people to help them brainstorm, you know, okay, I work in a hospital, what is my role in this, you know, and helping them think through that, and where did they feel comfortable doing, what were their superpowers, how could they call on those. And then our senator met with the legislative liaison from CDOT with our new governor, his staff, and they decided this was not the optimal year to run the bill. And so we've kind of taken a step back from the state level on that, but are still looking at how do we provide support to people who are looking at running this on a local level, because we do have one city and one county in Colorado who have a primary seatbelt ordinance, and there are other municipalities who are interested in doing the same thing. And so we're just kind of shifting it over in the meantime to how do we provide support to those folks to continue their work. And then I think soon we're going to kind of try to feel out some of the culture of the legislative session and understand what would be some of the barriers to this happening in the future. Because we are a democratically dominated session this year, House, Senate, and Governor, we anticipate that there will be some concerns about racial profiling. And so we really want to dive into the equity piece of this and make sure we're inviting people to the table that need to have their voices heard, and really having some deep conversations about this so that in the future, you know, it's going forward on a more balanced level. Anything you would add, Kate or Allie?
I guess the only thing I would emphasize is just the timing is everything piece. I feel like particularly with this story before the legislative session started, that was obviously on our minds to make sure that we were setting people up for success that could do a lot of this work where we couldn't once if the bill dropped. And then the other big piece kind of more broadly is obviously that the administration decided that they didn't want this run, which just obviously shifted priorities a lot, and means that maybe, you know, maybe next year is the right timing for it, and that kind of and like this year is kind of the do your homework year. What how we can create the right timing for it next, or or help kind of facilitate that.
Yeah, it makes me think through in this the State Health Department's role document. Is that all showing up on everyone's screen now?
Yes, it is.
Yeah, cool. Okay. So the differences that it talks about here of education, advocacy, and direct lobbying, right on the, which page is that? The 4th page. For us, we sometimes can get permission to directly lobby related to bills, but it requires the support of the governor, since we're in the executive branch at Public Health. And so without the support of the governor, we didn't get that permission. So often, and we can always do education. We can always help equip our advocates, but that direct lobbying really requires that sign off, and we didn't get it this year. So that definitely, changes the prioritization, and does, kind of takes it off the table for some advocates who didn't want people to go on record voting against it. So how about you all for your agencies? When do you, or how do you get permission to testify? I know many of you have, and can it only ever be technical testimony or data testimony? Do you get to testify in support of things, and how does that work for your legislative processes?
In North Dakota, the climate has changed because we did get a new governor elected in 2016. So he started in December of 2016, or I think it was December 20th of 2016. So in the 2017 legislative session and in this current legislative session, I've actually been able to testify in support and opposition of bills.
That's awesome. That's great. Is it a similar process of kind of just routing permission through governor's office in order to be able, prior to testifying?
How our climate actually changed was we have a new state health officer, and it started with the new governor. And previously we had a state health officer and then a deputy state health officer, because our previous state health officer did not have any legislative experience, and he did not want to deal with that and the fiscal aspects of things as well. So he asked to have a deputy state health officer, and she did all that. And so sometimes it would go to the governor's office and get turned down, or else we would be able to do neutral. But currently, there are a lot of Senate and House committees that do not allow neutral testimony anymore. So I'm very thankful that our governor allows us to, depending on the issue, allows us either to testify in support or opposition, depending on what the issue is. So, and I don't know for anyone else if anyone has been denied being able to testify, but I suppose it would depend on the issue.
Any other stories of how that works in your states?
Hey, this is Dwayne in Colorado. I can just share from a hospital perspective. Everything has to go through our government affairs and kind of get their blessing. And honestly, I probably make it harder for them than it needs to be because of my many soapboxes. So I'm always kind of chomping at the bit to, give an opinion on something, and they're like, whoa, pump your brakes and let's not weigh in on that. So.
Yep. Big lesson for me was there was a bill, I don't even remember if it was something we would support or oppose, but it just very clearly had a health impact where you would be able to assume which side a health department might land on, except I think we wanted to oppose it, but the person sponsoring that bill was also running a bill we wanted to have happen, and so we weren't allowed to take an opinion on that one bill, even though it seemed like a no-brainer. But because of the politics behind the scene of something else the same person was running.
And if I can piggyback on that, particularly as it relates to gun violence prevention or anything to do with guns, our hospital has historically previously taken a hands-off approach simply because we have many benefactors that are gun rights advocates, and there was a fear that we might alienate some of our donors if we took a more progressive stance on, limiting access to guns or things like that. So we've come around a little bit, recognizing the whole family influence on gun violence, and it's something that we're taking or making gradual steps towards engaging more in. So.
Yeah. Speaking of the change in oh, go ahead.
No, you go ahead first.
Well, I was just going to say our new governor, in his prior to being elected, said that he would direct the State Department of Public Health to do the research that the CDC cannot on gun violence, particularly as it relates to suicide. That was in one of his policy documents, but he's been elected and we haven't heard anything in particular of, because that would likely fall within our area, but trying to figure out, like, what does that mean? What type of research would he want? Does he want to put money behind it? What will that prioritization end up looking like? And we haven't heard yet, so it'll be interesting to see. Go ahead, Colleen.
Oh, I was just gonna put a plug in. Safe States Alliance is actually right now working their firearms policy statements, and the policy committee is meeting on Monday to talk, and I know a couple of you sit on that committee as well, but talk through the final feedback and edits to that, and then hoping to get approval from the executive committee of Safe States, and then also it needs to be voted on by the full membership. So hopefully that could be a potentially useful document forward.
Definitely. So my last question that I wanted to hear more from everyone on is, how do you keep your finger on the pulse of what's happening within the legislative session? And so I was going to share our resources. Let me, I'll also put it on the screen, but I'll share the link first in the chat again, just in case you didn't get that earlier. Here we go. So we have, we use something called State Bill Info, which allows us to create different trackers. So I pulled one of them up. The link goes to all of them, but you can see inclusion of bill on this report does not constitute any position on CDPHE's part. It's for informational purposes only. So this list may impact injury or violence prevention strategies or programs, impact substance abuse or mental health issues that affect injury or violence outcomes. So already just not even 3 weeks into the session, I know you can see how much scrolling I have to do here. We have a number of bills that have been introduced. I think I pulled open our motor vehicle safety just because it's a shorter list, but motor vehicle window tint, requiring traffic signals cycle yellow before green, eliminating red light cameras, use of mobile electronic devices while driving, commercial motor vehicle driver age, and increasing funding for transportation. We had some major initiatives for transportation that failed in the ballot, and electric motor vehicles. So it's something where we just track any bills. The most current version is always linked, the next date that it will be heard and in which committee or on the floor. Any news articles, you can see there's not very many, but if something's getting covered in the news, that would show up in that news section. Who the sponsors are, what the current status is, if there's any fiscal note attached, and if it's been amended at any level. And so we're able to then share this with our Violence and Injury Prevention Network across the state so that they can monitor kind of what we're looking at. But I'm curious how you all do that in your states and what it looks like, and is that a role that your local partners expect that you all play to keep them updated on what's happening?
This is Mandy again. In North Dakota, we have like a legislative website where we can go and track the bills and see what's going on. And then we also have on that legislative app, we just have like, I sign up for alerts, and then it'll alert me when there's been a change to a bill. And we don't have anything as nice as yours. So we create a tracking grid just on a Word document. We do that for we're under the Healthy and Safe Communities section. So for our entire section, we either monitor bills, track bills, or testify. And then we provide updates for our section on that one. And then our Injury and Violence Division provides a tracking sheet to our different coalitions that we have, like our Suicide Coalition and our Injury Prevention Coalition and the Domestic Violence Network. So that's how we do ours, but not as fancy as yours, but we still get information out to our partners just because they like to hear of that kind of stuff. And I think it's helpful even for the local public health. I always try to send them information as well. And then a lot of them are very grateful because they don't hear about it otherwise, and then they're able to come and attend specific hearings.
That's great.
Yeah, I would say, Mandy, even though this is a fancy version pulled from state bill info, we actually do also track just within our branch bills that we specifically like testify on or provide bill analyses on, and it's a cool spreadsheet. So I think Ellie is pulling it now, but it's just helpful to put some context in on how we responded to something that came up, or if we're just monitoring it. And we use both this and the other tracker that Ali showed online, actually for some of our evaluation metrics for our core state violence and injury prevention program, because one of the major strategies on there is around our policy work. So that's something that we use as actually an evaluation resource as well.
Yep. So you can see.
I was curious.
We just put on here when a bill general policy topic, you can see very few have actually been introduced yet, but different policy topics that have popped up. And then whether or not, so if we've been asked to do a fiscal note, if we've been asked to testify, or if we've just been consulted or provided data for something. So just really specific to the actions we take within the branch.
I was also just going to say, I'm curious if anybody, from the other states that are represented, like Jamin from Wyoming, or Lisa from Iowa, Jeannie or Celeste from Nebraska, or Leisha from Missouri, or Dana from Kansas, if you want to chime in on if your states do any bill tracking, because we're just not aware. I just don't know. I'm curious.
Yeah. So this is Jamin. So we do it in a few ways in Wyoming. So our department, the director's office, has an office of policy and evaluation, and within that office there are a few legislative liaisons who have created a dashboard that track all of the bills that could potentially impact our agency as a whole. And then typically they will notify us if there is a bill that they perceive would impact us in our units or programs. And then you guys would be super impressed. I have the most high-tech tracking method. I have sticky notes all over my desk with bills that are currently working their way through both houses of our legislature. So that's the high-tech way that I do it here.
I love it. And then Celeste chimed in, our agency uses our intranet. Our legislative liaison denotes the department should review a bill. We do legislative reviews for those we're allowed to. It mostly involves impact summary for our department impact, public and secondary, but trying to include where we can.
And I'll just add to that, this is Jeannie. Yeah, we do legislative reviews, but most of the time what we find out about a bill before our Department of Communications does is through our partnerships, through our Drive Smart Nebraska Coalition. I mean, without them, we would probably be a day late and a dollar short type of thing. So they really keep us informed on, hey, this is probably going to be being introduced, just be on the lookout for it. And sure enough, it just kind of worked well enough together that we all kind of are aware of what's going on.
So what do you wish you had to do legislative work better in your community? What do you wish you had access to or information, or if you could wave a magic wand, what would it be?
For Mandy in North Dakota, it would be access to more data sources. And like our hospital discharge data that we have, we're thinking about moving away from it. And there's some programs that are piloting receiving information from the Health Information Network. And so I'll let you know how that goes for us. But just because our hospital discharge data is not very reliable, and it's not required that hospitals submit data, so we have a very low response rate with hospital discharge data, and I can't remember what the % is.
Wow. It's a good magic wand. What other magic wands do you wish you had?
I think we're pretty fortunate in Colorado that we have people like Allie and Kate Cohen who are monitoring our bill trackers and adding to it and then like giving us a heads up. So it's been really nice, I think, and I would also say our program experts as well, just to keep keep tabs on what's going on. I think the ongoing challenge is just like the quick turnaround times for us, and so just especially if it's a bill that we weren't expecting and having to respond quickly. I mean, I think for some of the bills that get introduced, we anticipate it because we've been involved with partner discussions and stakeholder conversations, but every now and again, there's one that comes out of left field and we have to quickly act and respond. And I think interestingly with a new governor's office and with new department and division leadership, it sounds like some of our processes are shifting a little bit, and the information they're requesting is a little bit different. So just shifting what we need to respond to in response to transition is kind of a new challenge for us, I think.
Yeah. I think the only other magic wand I'd add is that I always find it hard to justify staff time. Well, I mean, I think it's easy to justify the staff time. We need to do what the bill asks for, but it's so quickly, it just keeps getting shot down where it's like, okay, that's at least going to take 2 people to run that project. And then leadership says, no, you only need 1. You're like, what? How did you make that? I calculated all the hours. I put in all the work. We showed you. And so just constantly feeling like we're understaffed to do the work that we're being asked to do, for me is one of the big magic wands where if I could wave one, it would be for everyone to believe what we ask for is accurate, and the work that it takes to actually get that done. Jeannie, I saw you take yourself off mute. Do you have a magic wand?
Yeah, I think one thing that I think that's missed opportunity, which we don't have control over, but we kind of are the experts, but you're always learning. But I don't think it'd be nice if they would rely on people that are involved in the field to actually reach out and just maybe get some general information on even the history of something, general facts, just so they can make a better informed decision. Even like with our child passenger safety law, you know, we were involved, but we were way hands off because we can't get involved. But, you know, it ended up being a good bill with some additional tweaking. But, you know, we're just not allowed to even just provide just basic information of, you know, why a kid should be in a booster seat, you know.
Yeah.
So that would be great if just to give good public health information more freely.
Well, Jeannie, I didn't ride in a booster seat and I'm alive, so.
Oh, I know. Lucky you.
That's my favorite argument.
Yeah, I've heard that one a few times.
Just a couple. Any other magic wands you wish you had? All right, well, thank you all for, oh, someone else jump in?
Oh, it's not a big deal. This is Mandy again. My other magic wand is that people would listen to reason, because sometimes I feel like there are irrational arguments for reasons why people don't want things. So it would be nice if people would, you know, you present the data and you present your case, and it, I mean, to me and other injury prevention people, it makes sense, but sometimes the flip of the coin is that they don't, you know, they aren't, it doesn't seem like their argument is reasonable.
Well, thank you all so much for sharing what's working for you, what you're able to do, where current priorities are, and what you wish you had. I'm going to turn it back over to Colleen, but definitely, you know, I think we have each other's email addresses through the calendar invites and through the emails Colleen sends out. And so definitely, if there's something you heard about today that you think you could learn from someone else, definitely reach out to them to be able to learn a little bit more and share some resources with each other.
Yeah, I'm happy to facilitate those connections too if you're not sure someone's email. But a big thank you to Allie for facilitating today. I'll make sure to post the recording on our Plains to Peaks Regional Network website, and Allie, if you don't mind sending the slides, I could post those as well.
Sure. And
our next call for our full group is going to be 2 months from now, so it'll be on March 18th. And then in February, on February 12th, we'll bring together the core funded states, the leads in those programs, but also if you are from a state that doesn't get core funding, you're welcome to join. I know last month we had a few people and it was a really great discussion. We talked about evaluation. During the February call on February 12th, we'll be talking about actually the motor vehicle topic a little bit more specifically. And so if you work on any motor vehicle activities, it'd be great for you to join. And I'm happy to send out that information as well. Other than that, thank you again for coming today, and we'll talk again in a couple months. Enjoy the rest of your week. Bye, everybody.
Thanks, everyone.
Bye.
Bye, thank you.